Do you know the best supplements to shrink an enlarged prostate? Find out in this video. 1. Lycopene is a dietary nutrient that is beneficial for prostate health. Food sources of lycopene include tomatoes, watermelon, and pink grapefruit. A 2018 study from Nutrients concluded that Vietnamese men with higher intakes of tomatoes and lycopene had less prostate cancer. A 2017 meta-analysis study of 692,000 people concluded that people with higher levels of lycopene were less likely to develop prostate cancer. And finally, a 2018 study showed that people with the highest tomato consumption were 19% less likely to develop prostate cancer than those who consumed less. Just my usual reminder. This video is for educational purposes only, so do speak to your doctor if you have any medical concerns. 2. Omega-3 fatty acids, fish oil. A 2014 study in the Journal of Nutrition found that most Europeans and Americans do not consume enough essential fatty acids. These important nutrients can be found in a variety of food sources, including fish, mackerel, cod, and salmon. Among the richest, nuts, chia seeds, flax seeds, hemp seeds, and avocados. A 2017 study reported in the Oncology Letter showed that increased consumption of omega-3 fatty acids reduced the risk of prostate cancer. Another 2017 study showed that those men who received prescription prostate drugs, finasteride and tamsulosin, for an enlarged prostate or BPH who took omega-3 fatty acids improved urinary flow compared to men only on the drugs. 3. Pumpkin seeds. Pumpkin also belongs to a class of foods known as cucurbita pepo. Long ago, pumpkin cultivation was done 7,000 years ago in what is now southern Mexico, and the ancients attributed benefits to the bladder, kidneys, and prostate. Science now confirms that this plant has benefits for prostate health. A 2016 study showed that pumpkin seed extract could help improve symptoms related to an enlarged prostate. A 2015 study of those with an enlarged prostate showed that those who took pumpkin seed extract had an improvement in urinary flow compared to those who took a placebo pill. Eating pumpkin seeds can be considered a healthy snack. If you take a supplement, follow the directions on the label. 4. Saw palmetto. As men age, many will experience symptoms related to an enlarged prostate, a condition diagnosed by doctors called BPH or benign prostatic hyperplasia. Symptoms include difficulty emptying the bladder, drainage of urine, reduced urine flow, and urinary frequency. There are prescription medications available to reduce symptoms, however, many prefer to try a more natural approach. Saw palmetto is a herb and according to studies may be helpful. A 2002 study by the Cochrane database concluded that saw palmetto provided mild to moderate benefits in urination-related symptoms and improved urinary flow. However, a 2017 study that lasted 12 months showed benefits for urine flow in men who took saw palmetto compared to those men who were not treated. There are also studies showing that saw palmetto, taken in combination with selenium and lycopene, is more effective than saw palmetto used alone. It has been observed that about half of the patients who used this saw palmetto extract experienced an improvement in prostate symptoms. There is also evidence that those who take saw palmetto in addition to prescription finasteride medications have additional benefits. A formula with ingredients beneficial to prostate health, including saw palmetto. We recommend the product Pro-STP recommended dose, as directed on the label. 5. Vitamin E. Foods containing vitamin E have beneficial effects not only on the brain and heart but also on the prostate. These foods include almonds, pumpkin seeds, sunflower seeds, spinach, strawberries, and avocados. A 2015 study showed that those who ate higher amounts of foods containing vitamin E had a lower risk of aggressive prostate cancer. 6. Vitamin D. Studies have shown that people with low levels of vitamin D in their blood are at increased risk for prostate and other cancers. In addition, a 2017 study in the Annals of Urology showed that those men with lower vitamin D levels have an increased risk for both benign prostatic hyperplasia and prostate cancer. Exposure of 20 to 30 minutes in the sun, letting your arms and legs get sunlight, can help generate adequate vitamins. However, depending on the season and geographical location, even this may not be enough. For the safety of most, a vitamin D supplement is recommended. Recommended dose: 1000 to 5000 IU daily. 7. Zinc. According to the Journal of Nutrition, nearly 45% of Europeans have an inadequate intake of zinc in their diet. Worldwide, more than 15% of the population is deficient in zinc. Zinc appears to play an important role in overall prostate health, and those with healthy prostates have higher levels of zinc than those with prostate disease. Now let's talk about foods to avoid if you have an enlarged prostate. Dairy products, including milk, are thought to be a risk factor for prostate cancer. A 2018 study in the American Journal of Clinical Nutrition concluded that total milk intake was associated with an increased risk of aggressive prostate cancer. Another 2018 study concluded that milk consumption after prostate cancer diagnosis was associated with an increased risk of recurrence, particularly among very overweight or obese men. Men with prostate cancer who choose to drink milk should choose non-fat or low-fat options. We recommend non-dairy options such as almond milk or oat milk. A 2017 study showed that those who consume a lot of saturated fat also have an increased risk for prostate cancer. Saturated fats are found in foods such as butter, cream, unskimmed milk, cheese, lard, and processed meats such as sausage and salami. Thank you so much for watching this video. As always, I wish you great health, wealth, and happiness.